Are you nervous about introducing allergenic foods to your baby? You are not alone, but here is the good news. Early exposure to common food allergens is now recommended to help reduce the risk of developing a food allergy. I'm Dr. Lena Vanderlist. I'm a mom of two, one who has a sesame allergy, and a pediatrician with UC Davis Children's Hospital, and today we are talking about food allergies in kids. In the United States, about 10% of people report having an IgE-mediated food allergy. That is 2 kids in every classroom. The 9 most common allergens are cow's milk, egg, peanut, tree nuts, wheat, sesame, soy, fish, and shellfish. A true food allergy is very different from a skin sensitivity or an intolerance like lactose intolerance. Babies very often will get a rash where new foods touch their skin. But if the rash just stays where the food made contact, it's usually not a true food allergy. A food allergy typically will not show up the first time your child eats a food. But with repeated exposures, you may see symptoms like hives, swelling of the lips, eyes, or throat, coughing or wheezing, vomiting, diarrhea, or in severe cases, low blood pressure or other signs of anaphylaxis. This will usually occur within minutes up to 2 hours after eating the food. But the key takeaway for parents is this: really early and frequent introduction of these common allergens in an age-appropriate form can actually protect against developing allergies. So around 4 to 6 months of age, after consulting with your pediatrician, try mixing some smooth nut butters into their purees or offering mashed up hard-boiled eggs. If your child has a reaction that seems consistent with a food allergy, your doctor may order them a blood test or refer for skin prick testing with an allergist. We only want to test for the specific foods that were involved in the event, because those broad panel tests actually produce false positives and lead to unnecessary fear and food avoidance. Once the allergy is diagnosed, the main treatment is going to be strict avoidance. With your child, create an allergy action plan to share with their school, their daycare, or their relatives. Teach your child how to explain their allergy, to read food labels, and ask about ingredients at restaurants. If an accidental exposure does occur, then the treatment depends on the severity of the reaction. For mild symptoms like isolated hives or itching, we recommend a second-generation antihistamine, like cetirizine, brand name Zyrtec, or loratadine, brand name is Claritin. These medications actually last longer and are less sedating than that commonly used medication, diphenhydramine or Benadryl. For possible anaphylaxis, meaning that your child has more than one body system involved, so they may have full body hives as well as vomiting or as well as wheezing, then you want to reach for your EpiPen. You inject it in the outer thigh and immediately call 911. It's important to remember that the EpiPen dose actually changes as your child grows. So when they reach about 65 pounds, check with your healthcare provider and make sure they have the appropriate dose, and always make sure you have an unexpired device at home. We talk more about food allergies in a recent episode of our Kids Considered podcast. Thanks for watching, and don't forget to subscribe for the latest episodes of Little Lessons with UC Davis Children's Hospital.